Hi, everybody. It is 4 o'clock on Monday. Time we come together and remember that we're going to get through this and we're going to get through it together. I hope everybody had a very Merry Christmas, has had a happy holidays, and is celebrating all of them safely. Remember that cases, especially 2 weeks from now, will depend on the decisions we made over Christmas and will depend on decisions we make over New Year's. 2020 is the type of year where we just have to do things differently. And I'd ask again, especially moving into New Year's, please keep any gatherings small. Wear your masks. What we do on these holidays in 2020 is going to dictate how many people are and are not with us for holidays in 2021. There's a light at the end of the tunnel. Let's make sure that we're making the types of decisions that protect people as we get there. I want to start with an update after last week about where we are in general fighting the virus. Now, last week, we do have some days where labs were not open, and more days with Christmas and Christmas Eve falling on Thursday and Friday that labs are not or were not open. There also may be some issue with the AT&T outage on some of the reporting. But let's look at our stair-stepper chart. Okay, we're working on the stair-stepper chart. And what you'll see is a significant decline from last week. 4 weeks in a row with a decline. And last week was the lowest that we have seen since November the 9th. Now, what it does show is that we have certainly stopped the exponential growth, this third wave. And I believe that now we've not only plateaued it, but we're starting to see cases decrease. Now, they won't or they haven't decreased as much as, if we get the slide up, it'll show you. But it's safe to say, actually, it's certain to say that the steps we took, that temporary closure of indoor dining and bars, the restrictions on gatherings to make them very small, only 2 households, that it had and made a real difference, even the move that we had to make with regards to schools. Now, remember that deaths trail cases. And so we are still seeing the death toll of that exponential increase, and it's heartbreaking. But the weeks to come should be better based on your decisions to do things right and making sure that we are following through on following the guidance and doing what it takes to defeat the virus. I think they'll let me know when we can get that slide up. Positivity rate, which is calculated differently, which shouldn't be impacted as much by the reporting and the number of days that labs may have been closed. This last week ended at 8.06%. Again, the lowest since that November 8th date. Now, okay, here's the stair-stepper chart. It's up. As you can see, it's pretty dramatic. And it looks a little overly dramatic because of this last week. I believe that we'll see these cases coming in this week, but again, with New Year's Eve and New Year's falling at the end of the week, it may be that we have 2 weeks that we kind of have to average in with the one that will follow. We're also a little bit concerned on what we saw out there anecdotally in or around Christmas, number of people out, whether that's shopping or doing other things. We're going to have to see what type of impact that has. But again, you can look at this stair-stepper chart and see we have stopped the third wave. What we've got to do now is make sure that cases continue to decrease until we can get everybody vaccinated. All right, let's show the test positivity. All right, again, this is showing a lot of the same thing. You see the increase that we were going through as positivity went up really from 3.62% to 9.75%. We're down primarily to a plateau right now at about 8. Today's is just under 8. We'll hope that that'll continue to decrease. This is a leading indicator suggesting where things are a little bit ahead of what we see on cases. Let's look at the inpatient census. This gives us another indication that our steps have worked. Really, starting November the 21st, we saw a plateauing, a leveling out, and really a high point of Kentuckians in the hospital for COVID. And look at how much that was increasing really since the 3rd of October, and how significantly it was increasing really in the middle to late October through that point in November. November 21st is just enough time for the steps that we were taking to have a real impact. And we hope that this isn't just plateauing out, but will decrease, because if we can decrease our COVID-19 inpatient census, there is more hospital capacity to make sure that we can help people not only who come in with COVID-19, but heart attacks and strokes and other issues that you desperately need medical attention for. We see the same thing in the COVID-19 ICU census, where, again, pretty much that date, November 21st, the significant and rapid increase stopped, and we saw a leveling out. So you can see in cases, you can see in the positivity rate, you can see in the hospital census, and you can see in the ICU census, all showing that we've been successful. And yes, I know it took sacrifice. And yes, it was harder on certain small businesses than others. And we're going to have to provide additional relief to those groups. But those sacrifices were not in vain, as the rest of the country sees continuing increases in cases, as the rest of the country runs out of ICU beds and hospital beds. At this moment, we've stopped that from happening in Kentucky. But we can't let this success go. We've got to keep it up. Otherwise, we can be back very quickly to a more dangerous place. Let's look at our hospital capacity by region. Again, another indicator. We're down from 3 areas in the red to 2. The one is really close in ICU beds at 79.6%. So again, we have capacity right now, but know that it can change, and it can change very quickly. It takes us being vigilant, staying on task, and knowing we've got the right game plan, but we got to execute it day after day after day. Can't get tired anymore. We got to make sure until everybody can get this vaccine that we do things right all the way to the end, because otherwise we are going to sustain losses. We're going to lose people we care about where it's completely avoidable. Let's go to vaccines. Our update is always going to start with the allocations that have been provided. We're going to get another allocation of Pfizer, I believe, in our system called Tiberius tomorrow. We'll let you know tomorrow how much that's going to be. But as you can see here, 5 allocations thus far that'll provide 202,650 doses. Certainly the first week of Pfizer, the first 2 weeks of Pfizer, I think, have all been received now. The first 2 weeks of Moderna, all been received now. That very last one you're seeing from Pfizer is coming in as we speak, and the next one we'll get really the first part of next year. Let's now show the update on distribution. We continue to grow our providers. So 40 new sites. Remember, the first Pfizer was 11 acute care hospitals and was our CVS Walgreens program for long-term care. Then we ended up getting at least an amount of vaccine to every other acute care hospital and many of our local health departments. Now we continue to expand who's receiving them, and why we have to build this up is right now the vaccine is trickling in. I love having 200,000 doses, but it's not enough. But as production ramps up, as more vaccines come online, we're going to have a lot more coming in. And as we move into the next priority phase and eventually the one after that about who gets the vaccine, it's going to be bigger and bigger populations. So we need more and more providers, more groups that are able to receive this and ultimately then provide the vaccine to people. So this is building up our distribution, our provider network. And remember, this is, I think, one of the toughest logistics challenge, one of the largest ones we've seen since World War II. So it's not going to be clean the entire time. We're building the airplane while we're flying it. I'm sure that there are going to be mistakes made all around, but right now we believe we've got the right plan building in the right way to distribute this vaccine equitably all across the state and make sure that that we have the opportunity, spring, summer, to get everybody who wants to be vaccinated. All right, update on doses administered. So what we're learning, and this is happening in every state, is it does take some time to vaccinate individuals. If you think about the hospitals that are getting them, they can't vaccinate everybody on that first day. What if people have complications to it? They can't decimate their workforce. And so what they're having to do is schedule it out, and it's just taking a little bit longer, but it's being done thoughtfully. So what you can see is we believe we've had at least 26,336 vaccines administered. Walgreens and CVS, this was their first week, this last week, in vaccinating long-term care. This will ramp up a lot more after the holidays. We are pushing for vaccinations to continue New Year's Eve and New Year's Day. I would hate for somebody to succumb to a virus because anybody took those days off. We need to make sure that we are getting it out there as quickly as possible. For an update on the Walgreens CVS long-term care vaccinations, we'll go to Secretary Friedlander. But let me just say, remember, this is a contract with the federal government between Walgreens and CVS and the United States government. We do not have operational control over that program. We are working with them, and we're going to continue to work with them. So, Secretary Friedlander.
Thank you, Governor. As you started out, there is really solid news for Kentucky. The sacrifices we've all made together have made a difference. So to continue that solid news, to continue what I consider to be that good news, Walgreens and CVS have been able to vaccinate and been able to provide over 30 facilities, we believe, as well as then over 3,000 staff and over 3,000 residents and over probably 2,500 staff. We think this is a great start. And these are, in terms of residents, our most vulnerable population in Kentucky. And we are making a beginning, and we're making a down payment on the promises to take care of those who are most vulnerable first. And then also those healthcare workers who have been in those facilities, who've helped and provided services and support to those residents all along. This is a way that we are able to prioritize, again, those folks who have done the most for the most vulnerable. So Walgreens, CVS, thank you. We'll continue to work with you. We've talked with them just about every day as we learn together. As the governor said, we're learning as these things roll out what the best way to proceed is. And they've been good partners with us, and will continue to be good partners with them. Now, for facilities, again, thank you for welcoming in CVS and Walgreens. Make sure that when you get the call, that you're prepared. Make sure that we're ready to roll these vaccines out in the facilities. So far, we have done a very good job, and we'll continue, as I say, to learn. And here's the other thing. Those of you across the Commonwealth, here's what we can do to continue to protect our most vulnerable populations. We're continuing to provide testing in these facilities. We're continuing to provide the strike teams. We're very thankful for the federal support that's going to allow us to be aggressive with these facilities. But folks in the community, remember, this is what you can do to protect our seniors. Please do that. Governor, back over to you.
Thank you, Secretary Friedlander. Just to make sure I'm clear, and I don't think that I was, hospitals are just being careful about spreading out the days that their staff are vaccinated in case someone has a reaction to the vaccine. We are not seeing those reactions. They are just planning carefully because our healthcare capacity is so critical to being able to treat these patients. It's out of an abundance of caution. So I wouldn't read anything else into that. It's not something we're seeing, but it's the right type of planning to do if healthcare capacity is a concern. And that's why we are prioritizing our healthcare workers to get this vaccine first, is to preserve that capacity and to protect them doing their job. Long-term care, 66% of all of our deaths. That's why that has to be prioritized too. Now today, we're going to talk about the decision on the next group once we get through healthcare workers and long-term care that'll have a priority for getting this vaccine. I'm going to have Dr. Stack walk us through this. What he's going to talk about is the recommendations from the federal government is a group that is far too large, something they admitted to do it all as a group in the next phase. So we've got some key priorities that I believe are shared all around the state, and we have an emphasis on preventing deaths and making sure we can deploy the vaccine as quickly as possible to the group that suffers the most, the worst outcomes from this virus, which are our seniors. Dr. Stack.
Thank you, Governor. All right, here's how we see if how things go here. I'm not sure if I have the right version of my slides. Scotty, if you can put up the slides you have, and we'll see if they're the ones I need. So let me talk. Well, there we go. So that's the correct first slide. We'll see if we go along if I have the right one later on. So I want to talk real quickly, or not so quickly, about how we're going to work through phase 1A and then phase 1B and some of the different priorities that are attempting to be addressed and how we hope to work through that. So we go to the next slide, please. So here you'll see we got about 330 million Americans in our country. We have 2 vaccines just recently approved for use. The Pfizer is usable for people 16 and over, and Moderna is authorized for people 18 and over. Using round numbers, we have about 250 million Americans who are 18 and older, and we have potentially enough doses of these 2 vaccines to immunize roughly 50 million people by about March 1. So you can do the math. That means no more than 1 in 5 eligible Americans, and fewer than 1 in 5 eligible Americans, more like 1 in 7 Americans overall, since people under 16 are not authorized for the vaccines, can have access between now and March. So it's going to be difficult as we work through this, and we have to set priorities, and we have to set priorities in ways that give the greatest benefit and protection for individuals and society. So next slide, please. I have used a couple slides in here from the Center for Disease Control's Advisory Committee on Immunization Practices. That's what CDC ACIP stands for. Dr. Dooling is one of the experts who has presented at these sessions and is one of the leaders for creating these paradigms for immunization prioritization. Phase 1A includes long-term care facility residents and healthcare personnel. You'll see they put a scale here intentionally to show they are trying to balance preventing morbidity, which is healthcare injury or harm, and mortality, which is death, with the preservation of society's functions and the things we need to do to keep society operating. So they have tried to use this balancing act as they go through these early phases of vaccine deployment. Now for 1A, Kentucky, and I think the vast majority, if not all states across the country, are following this very closely. And this is why we fully activated the CVS and Walgreens federal program that the Secretary just spoke about, so we could reach the most vulnerable persons in our state. And I'll emphasize here, nationwide, about 40% of all deaths have occurred in nursing home residents. In Kentucky, perhaps because we've done such a good job protecting the larger population and have fewer deaths overall, we have 2/3, or about 68% of all of our deaths, have occurred in nursing home population residents. And so we have prioritized fully operationalizing that program to protect those vulnerable individuals who are at greatest risk in our state. Healthcare personnel obviously are essential to keeping all of us healthy and well. And when we're sick, we need them to help take care of us. And we've talked repeatedly over the last few months about the difficulties in not having enough healthcare professionals to provide the care we need when the healthcare system gets strained. And so there was really no dispute about these priorities, and there was clear consensus nationally and across the country. If we can do the next slide, please. So on this slide, this is another Dr. Dueling image, and it was from the same meeting. And here's where I'm going to point out some of the challenges. The paradigm of preventing morbidity and mortality and preserving societal functioning starts to get very, very difficult to follow already in phase 1B. So I put these red numbers in here. There's about 3 million long-term care facility residents, we think. There's about 21 million healthcare personnel. That's phase 1A, so that's 24 million people nationwide. Phase 1B, they used people 75 and older. That's about another 21 million people, some of whom live in nursing homes. And then they broke out or subdivided the essential workers category into frontline essential workers and other essential workers because it was so enormous. 87 million Americans, they estimated, in these categories. They kept 30 million of them in categories they defined as frontline essential workers. Now, I told you that there's about 50 million doses potentially available, or 50 million vaccine courses available by March 1st. If you add up all these numbers, you've got probably 70 million people. You do the math. There's not enough to get to all of these people by March with the quantities of vaccine that are projected at the present time. So ACIP acknowledged there would inevitably be a need to make further sub-prioritizations, and that was part of their dialogue. I listened to their hearing when they did this on a Sunday afternoon. This was part of their dialogue. And if you look to 1C, and we're not there yet, the population is staggeringly enormous. If you look at the people 16 to 64 with high-risk medical conditions, more than 110 million people, none of whom are likely to be covered by, obviously, by age. They're not covered by the 75 and older crowd or the long-term care facility residents. So these are really, really enormous buckets. If they weren't further subdivided, there's no way we'd get through these in any kind of orderly or reasonable fashion. Next slide. This is where I may be worried I have the wrong one. Oh, okay. So in Kentucky, on the preventing morbidity and mortality, I want to just show you our specific data for our state. So in our state, people who are 70 and over are about 11% of the total state's population. But these people who are 70 and older, when they get COVID, they have a 3 to 4 times risk of hospitalization compared to the overall population, and they have a nearly 4 times risk of ICU admission. That's what you can see in the top left bar graphs, is that for all ages, it's about 1.2% go in the ICU and about 5.2% go into the hospital. But the numbers for the people who are between 70 to 79 and 80 and over are much, much higher than the general population. If you look down in the bar graphs in the bottom left, this takes all people who have had COVID in Kentucky who have ever been admitted to the hospital or the ICU, and you can see that the same numbers play out. So about 40% of all of our hospitalizations for COVID are in persons over the age of 70, even though they're only 11% of the population. And for the ICU admissions, it's about the same actually. So, and then finally, 75% of all of our COVID-19 related deaths in Kentucky have occurred in persons 70 and older. This is clearly the population at greatest risk for serious medical needs requiring hospitalization and intensive care unit care, and also the population at greatest risk for death. So by helping to protect this population, clearly we help to provide them some protection from these great harms. But additionally, it helps to keep people out of the hospital with COVID-19. And then that therefore helps all of us in society, people who have other problems that are not COVID related, such as heart attacks and strokes and appendicitis and a bad gallbladder, all sorts of other things you need to have taken care of, rely on having hospitals and healthcare settings with sufficient capacity to meet your needs. And to the extent we can keep people with COVID who are seriously ill from filling the hospitals, we can keep other people having access to the care they need and keep the rest of society open for business and operating. Next slide. Let's see if this is the right or wrong one. There we go. That's good. Thank you very much, Scotty. You got it right. So this is a summary now of what we are going to do in Kentucky for phase 1A, which I've already talked about, and phase 1B. So again, for phase 1A, and I broke it out for clarity here, long-term care facility, that's LTCF, is what we usually would call a nursing home. And then ALF is an assisted living facility. That would be, well, that's self-explanatory. And both of those populations were included in the federal program with CVS and Walgreens. And so we fully activated those programs. Healthcare personnel, and I just sent a memorandum out today to all healthcare personnel across the state via licensing boards and professional associations. Healthcare personnel includes personnel working in clinical care settings where patient care occurs. This is in the inpatient or hospital setting, the outpatient setting, so offices. I've learned I have to mention dentists specifically. If I don't call out dental, it somehow doesn't get included in the rest. Home-based care, if you're a therapist going into someone's home and providing healthcare services, you're included too. It is not specific to your role. This is any person providing services or work in the clinical care setting. So this is also people who greet you and sign you in at the front desk. It's people who help keep the facility operational and the facility clean. It's individuals who help provide translation services. It's students, clinical trainees who are in that setting. So it's all healthcare personnel in clinical care settings. And this is distinctively different, though, from an office park somewhere where folks are perhaps coding and billing charts or doing medical administrative work. Those individuals are not in a clinical care setting where patient care occurs and would be in a subsequent phase. And we'll work on this for clarity. I have to ask all of the healthcare personnel, there are probably at least 200,000 people, if not more, in this category. I need to beg your patience. We are doing the equivalent of a World War II mobilization here, trying to bring up to speed this incredibly complex undertaking. It's going to take a few weeks, both to get the systems in place and also to get enough vaccine to reach everyone. So please, the memo today begged everyone to be patient and understanding while we ramp this all up. Turning to phase 1B, in Kentucky, we are going to include people who are 70 and older. So that's 5 years younger than the CDC recommended. So we believe here, clearly because we have such a disproportionate burden of death and morbidity in this population, we want to make it available as quickly as possible to this population. We are also going to include first responders, so think police, fire, and EMS, but emergency medical services are already covered in healthcare personnel in phase 1A. And then K through 12 school personnel. This is all persons who are in the school buildings, so regardless of their role. So again, this means it's teachers. It means if you're in the school building itself, your administrative personnel. It means it's housekeeping. It means it's maintenance, bus drivers, people who are directly engaged with the students and in the learning environment or in the transportation role with the school buses would be included in this. Off-site administrative personnel, just like healthcare, are asked to please wait until a later phase. We're trying to get these locations safe, and I'll touch on this on the next slide, I think, briefly. Here, so you can move on to the next one, James. So here are my concluding thoughts on this. And I think perspective is so important. I've told you all, I haven't told my stories for a while, my history stories. I read history because it helps put things in perspective for me. So here's a big picture perspective. Never before in human history have we had 2 brand new vaccines to try to help eliminate a global pandemic in less than 12 months. All right. It's a modern medical miracle. I've said that repeatedly. Deploying these new vaccines is incredibly complicated. It's federal government, state government, local government, public entities through the government, and many private partners such as CVS, Walgreens, hospitals. It will be pharmacies, it'll be medical clinics, federally qualified healthcare centers, rural healthcare centers. It's a lot of people involved. It's complex, and it's going to take some time to get it up and running and efficient. It is inevitable there will be frustrations, uncertainties, and missteps, particularly at the start, which is why everybody has to be patient. And then I mention again, just like the governor says, we'll get through this and we'll get through it together, but your patience is needed. So I'll beseech you, calling us and emailing us. We want to be responsive. We can't reply to everybody who wants to know, where do you get an appointment or how do you get access? A lot of this hasn't been built yet, and it will become more apparent in the weeks and certainly in the short next couple months as they follow. So we are committed to doing this as fairly and equitably as we possibly can, getting this vaccine out as quickly as we are able. And remember, while it makes for a wonderful story about getting this Christmas gift under the Christmas tree with these 2 vaccines, trying to start up something this complicated with 2 4-day weekends back to back just only adds to the complexity. And I've spoken with my colleagues in other states, fellow state health officials. They are having the same challenges we are, just about getting systems in place, identifying populations, messaging and communicating. They're all the challenges you could reasonably expect for an undertaking this enormous. But I am confident we're going to get through this, and we'll get through it together. And if we are fortunate, we may even have additional vaccines approved in the February and March timeframe. And if that were to happen, then we'll have vaccine administration sites onboarded and ready and be able to deploy them more efficiently and reach more people more quickly. And so if we're fortunate, by the end of the summer, perhaps as many as half of the state who are interested and willing in getting the vaccine will have been able to be immunized by the time we enter the middle or the end of the summer. And then the people who remain will be the lower risk categories. And it's our goal to make sure everyone who wants to be vaccinated has access to it in a prioritized way as efficiently as possible. So thank you for your patience. And for all of Kentucky, thank you for your own leadership and urging your neighbors to be patient. And I would be remiss if I don't add to what the governor said before. We are in a sea of red right now for COVID. If you look around, Tennessee, when I looked last night, has the highest rate of new disease in the United States for the trailing last 7 days. Tennessee, just to the south of us. Indiana had a very, very high rate. Ohio had a higher rate than us. All 3 of those states were much higher than Kentucky. We are literally like the eye of the storm in the middle of a hurricane. And it is only going to be your actions, your voluntary choice to not travel to these other areas, to not host parties at your house that mix and match multiple people, to make sure you are keeping your social distance more than 6 feet and you're wearing your masks. Whether we sink or swim over the next 3 to 4 weeks is going to be solely determined by the choices people made the past 3 to 4 days and the choices you make this week and through the New Year's holiday. So folks, ball's in your court. We've given you the tools. We've told you what needs to be done. And now we're working real hard to deploy this incredible therapeutic to prevent disease in people who get COVID, and hopefully to prevent COVID in many other people who may not even get infected. We'll see that with time. But until we get there, ball is in your court. We need y'all to be kind and be caring and look out for each other. And the best way you can do that right now is to not spread infection by following these public health measures. Governor, thank you for this time, and it's back to you.
We'll move into today's report. Again, Mondays are always lower. Today's may be lower than normal, most likely because of a combination between the long holiday weekend as well as potentially some communications being down based on the bombing in Nashville. So today we're reporting 1,455 new cases of COVID-19, 1455. We're also reporting 8 new deaths today. We currently have 1,552 Kentuckians hospitalized for COVID-19, 411 in the ICU, 217 fighting for their lives on a ventilator. Our positivity rate today is 7.97%. Looks like number of total tests, 3,385,971. New cases by county, Jefferson, 225, Kenton, 83, Warren, 51, Pulaski, 51, Boone and Boyle, 49, Fayette, 47, Marshall County, 40, Henderson, 39, Mercer, 39, Davis, 32, Campbell, 30. The rest can be found at kycovid19.ky.gov. Folks we've lost today, whose families are going to need our help, for whom we should be lighting our houses or our places of business up green. Green is the color of compassion and of renewal. Ringing our bells at 10 a.m. Those that we've lost include a 92-year-old man from Bath County, a 74-year-old woman from Grayson County, a 64-year-old woman from Henderson, a 93-year-old woman from Jefferson, a 41-year-old man from Jefferson, a 67-year-old man from Jefferson, a 79-year-old man from Jefferson, and an 80-year-old woman from Madison. To give you another idea of why we've prioritized long-term care, only 2 of the individuals today that we lost were outside of long-term care. We have reminders that these aren't just ages and counties and genders, they're real people. So today's memorial is a very difficult one to share, as it's the second passing of one of our frontline heroes from Med Center Health in Bowling Green. After losing Rebecca Shadowin in September to COVID-19, the hospital reported the loss of Dr. Don Miller on Monday, December 21st. Dr. Miller had been an ER doctor at the Med Center for 17 years. In early December, he tested positive for the virus, passing weeks later after a hard-fought battle. Connie Smith, Med Center Health's president and CEO, said Dr. Miller worked faithfully alongside his emergency department friends and colleagues on the front lines of the COVID-19 pandemic since the first Med Center Health patient tested positive in March this year. He provided outstanding emergency care for our patients both before and during the pandemic and will forever be remembered as a true healthcare hero. Other colleagues like Seth Wilson stated that Dr. Miller's methodical approach to emergency medicine will forever leave a lasting footprint on the entire medical community. But more than anything, Dr. Miller was a good man. His friend and coworker Jackie Evans said that Dr. Miller was compassionate and had a wicked dry sense of humor, a great work ethic, and only wanted the best for his patients and his coworkers. If a coworker was ill, Dr. Miller would be the one to check on them and their family to make sure they were okay. It is hard to describe the impact that Dr. Miller had on those around him. His good friend and colleague, Dr. William Moss, the medical director of emergency services, shared a few words on who Dr. Miller was via a video we're going to share with you now.
Dr. Miller was a friend of mine, and I will always remember him as a very kind, compassionate man who was very slow and deliberate about his care for his patients, and he would always make sure that the patients were cared for first and in the right way. His training in Baltimore and at University of Louisville under Hiram Polk in surgery made him a great, skillful physician, and be really, really missed. Don was an older gentleman as myself, and he could have easily have retired or shied away from patients, but Don did have some health problems, and he knew the risk, and despite that, he continued to take care of patients with COVID, and he was a true hero in the fact that he wouldn't shy away. There have been many providers and physicians who just refuse to see patients sometimes about this situation, but nonetheless, Don just plowed through and saw patients and took care of them. The most admirable thing I can tell you about Dr. Miller is that he loved his family. He loved his wife and his 11 kids. He lived out in an area in middle of Kentucky near Bernheim Forest, and he just cherished his time with his family, and he took care of them. And some of his last conversations with me were making sure that they were taken care of and there was no burden on him. So we're going to miss Don. He was an amazing person. He was a great friend, and if he were here today, I think he would still tell everybody to do as much as they could to help prevent the spread of this, so others won't have to deal with the burden that he and his family are dealing with right now. Thank you.
Thank you to Dr. Moss. And today our prayers are with Dr. Miller's wife, Teresa, and their 11 children, as well as the entire team at Med Center Health. Dr. Miller paid the ultimate sacrifice for caring for other people, and he's always going to be remembered as a hero. Let's remember that it's our actions, the actions of the community, that can better protect Dr. Miller's colleagues, and I know it's what he would ask of each and every one of us. To Teresa, to his 11 children, thank you for your father and his time on earth with all of us. Thank you for his sacrifice. Because of that sacrifice, others are around today, and other families aren't going through what you all are going through. In his honor, we will wear our masks. In his honor, we have a wreath on the front of this Capitol that lights up green every night. Tonight, it's going to light up green for him and the others that we have lost today. Folks, please remember that those on our front lines are paying this price. Let's do everything we can to protect them. Our long-term care update today, 165 new residents testing positive, 134 staff. This is why we have to vaccinate the staff as quickly as possible too. Look at that, 10,311 of the cases that we've had to date are with long-term care staff. They are at risk. They are seeing significant exposure. We've got to get them vaccinated. 87 additional deaths since our last update can be attributed to long-term care residents and or staff. All right, tomorrow we're going to provide an update on the new CARES Act. We have received some estimates, and they're only estimates of what it'll mean to Kentucky. It's going to be a significant infusion in our economy. It's going to help us truly help those that have been harmed in this pandemic, but we're going to have to do more in our upcoming budget. Now, that's for more than a week from now when we'll do the State of the Commonwealth. But know that help should be on the way, and there's a time coming up soon where we can also invest in a brighter future whereby we will defeat this virus, and we ought to have better days ahead, not just in what we're dealing with now, but we're going to have an opportunity to come out of this stronger and better positioned in a post-COVID world to leave this state a little bit better than it was when it was put into our hands. And hopefully we, as the adults that'll pass it along to our children, can absorb as many of these scars from COVID as possible so that their path in front of them is as bright as possible. All right, we have a number of journalists on the line. I have just a couple of written questions. We'll start with Alex Kisto from the Lexington Herald-Leader.
Hi, Governor. There are reports today that a Walgreens location in Lexington, as I'm sure you've heard about, had leftover doses of the vaccine after doses were given to long-term care facilities, and some amount of them were given out on a first-come, first-served basis to the general public. You said that your office doesn't have operational control over how CVS and Walgreens distributes just because they have a federal contract. What is your office's reaction, though, to distribution like that, if it is indeed happening, when it doesn't align with the state's phased plan of how to distribute the vaccine, or the CDC's?
So we believe that there was a Walgreens store in both Louisville and Lexington that had this similar occurrence happen. It shouldn't happen. If more of the Pfizer vaccine was thawed than they thought could be immediately used, what needs to happen is the next long-term care facility, the one that vaccine is supposed to be saved for, needs to be contacted, and they need to do what it takes to get it out to that facility in time. Now, I don't think that this was intentional, and we have to understand that in a undertaking this massive, mistakes are going to happen. I believe that here a mistake happened in the thawing, but the reaction wasn't what it should have been. Now, do I believe it came from a good place? Yes, because they didn't want any of it to go to waste. But should it have been done differently? Yes. Are there procedures in place that should have been followed that would have done it differently? Yes. But we're going to be working with these facilities to ensure that the right thing happens next time. And it's important that the public know that there's not going to be, pop-up opportunities at Walgreens or CVS for the public to come in on a first come, first serve basis. In the future, if these cannot be given out to a long-term care facility, if this happens, we're going to provide some additional guidance for those that are most at risk that the pharmacy will be able to provide it to. But again, under all the policies in place, shouldn't have happened. I don't think it was intentional, but it should have been done differently. Debbie Yetter from the Courier-Journal.
Hi, Governor. It looks like deaths are continued to increase in December from COVID rather markedly. Do you foresee that trend continuing with maybe in the aftermath of Christmas, or do you feel confident that may start to decline?
So let's put up our stair-stepper chart while I answer this. And as Debbie knows, deaths trail cases by 2, 3, sometimes 4 weeks. So what we are seeing right now, Christmas Eve, we had 50-something deaths, are the number of deaths that occur when we had that drastic increase of cases. Now, we have seen, let's take out this last week, a drop in cases, which means we hope at least 3 weeks from now, we're not seeing 50 or 20 deaths. Hopefully, we're seeing a few less. Now, our ability to hang on to this, either on this chart or deaths, is going to depend on what we did in Christmas and around Christmas and what we do around New Year's, because we blunted what other states are seeing from Thanksgiving. But again, if we start gathering a lot and taking off our masks, we can frustrate everything we've done. We have stopped the exponential growth from the third wave. Now, can that growth start again if we abandon the things that we know prevent the spread of the virus? Sure, it can. And so we'll see here within a couple weeks about the impact of Christmas. And Debbie, if the cases go up, the deaths go up. Shelby Smithson from WKYT.
Hi, Governor. Do we happen to know how many doses were given to the general public from those Walgreens? And also, for those people who got the first dose, could they expect to run into any problems getting the second, considering they were never intended to get that first dose?
Right. I don't have a number on how many vaccines were given. If that's been reported to us, we'll provide it to you. We're going to need to make sure that those individuals who got it receive the booster. Again, it shouldn't have happened this way, but those individuals that have received the first shot within those period of weeks, we need to make sure that we don't frustrate that vaccination. So pharmacy is going to have to work with those individuals to ensure they come in a second time. Now, you got to fill out a consent form and you get a card on the vaccine registry when you get vaccinated. So we should be able to contact them. But what it means is that there is another dose that the federal government has that is waiting for them. Again, we hope that this situation doesn't happen again. But when we look at deploying millions of vaccinations across Kentucky in the coming months, there's going to be mistakes. There just is. And as the number of providers increases and increases and increases, and situations happen and people panic, which they unfortunately do, some of these situations are going to happen. We're going to try to minimize them as much as possible, but I also want to set reasonable expectations when human beings are involved in getting this vaccine out. Catherine Collins. Okay, then I'll read a couple of stations. What are my thoughts on the federal stimulus? I'm glad that the president signed it. We're going to walk through tomorrow how it provides almost $300 million in rent and utility bill relief. That's going to help a lot of people. It'll infuse over $2 billion in our economy in those direct checks. It's going to help a lot of folks receive additional weeks of unemployment and the dollars, the $300 on top. We've seen how well that cycles through the economy. It's going to provide some relief for those that have had to bury their loved ones in funeral costs. We're going to walk through all of it. But does it do enough to alleviate some of the issues facing states across the country? Well, first, there's a lot in it, and I'm grateful for that. Money for testing, tracing, vaccine distribution. We've engaged in some strong fiscal management where our budget is not in the same situation that some other states are in. But should more be done? Yes, because if more is done, I believe that the length of this recession will be shorter. Same thing I'm going to talk about with our state budget. Investing now means a shorter recession, more people at work, more relief for our families. When people are hurting, you don't wait, until a year from now to provide assistance. Is the $600 enough for a stimulus, or do you believe it should be raised to $2,000? I'd be in favor if the federal government wants to send Kentuckians $2,000 checks. And am I concerned that providing stimulus money could have an adverse impact on the deficit? Sure, it's going to have an impact on the deficit. But when you have the Federal Reserve, who are some of the lead economists, some of the smartest people in that area saying you can't stimulate the economy enough right now, I believe them. All right, Joe Ragusa from Spectrum.
Hi, Governor. So I want to ask about testing right now, and obviously, we're in between the two holidays, Christmas and New Year's. So testing numbers are going to look down. But I personally ran into some difficulties scheduling my own test for a precautionary reason, and I'm wondering if a lot of other people are having the same issues. But given all of those factors and the low number of testing that we're anticipating because of the holiday, what issues do you see having gauging the actual impact of the coronavirus after Christmas, after New Year's? How do you actually gauge just how bad things are getting after those two holidays?
So there'll be a couple ways, and they're not just the case numbers. The positivity rate should give us a leading indicator. What we're seeing from testing is there's still a lot of testing that's going on in Louisville. In Lexington, we need to take steps, and I know locally they're taking steps to encourage more testing. And Lexington served a much larger region than just the county itself. But we've now have so many testing locations. We need people to continue doing it to stay safe, especially if you are going to gather over the holidays, or if you just did, get tested. Let me make that a clear message. I can't do anything about whether you got together in a big group or in groups that had multiple households over Christmas or the break. But if you did, please get tested. And if someone around you tests positive, please go get tested. It's better to know to make sure that you don't spread this virus. But we're going to be watching testing numbers. We are probably going to relocate our second surge site. We'll have some news about that, I think, tomorrow for after the New Year's. We're seeing some high numbers in a number of areas in the state. We need to make sure that we have enough opportunity out there. Our hospital testing still going really strong as well. Karen Czar from WUKY.
Good afternoon, Governor. Tagging on a little bit to Joe about testing, I've been tested probably about 4 times now. The first 2, all at the same location. It took 4 to 5 days to get results. The last 2, I had results that evening. Are you getting reports of that throughout the state of much quicker results? And how is that helping control the spread? Thank you so much.
Thank you. It's really important that when we have testing, that people get results preferably in 48 hours. And what that means is, especially if you're concerned you're symptomatic, don't go to work while you're waiting a test. If you think you might have COVID, don't go to work while you're awaiting a test. If it's just routine testing, that's a little bit different. But our goal here is, we need to know who's positive and we need them to isolate. And if it takes too long to get the results, then we may have people who've been out and about while being positive. Most places in Kentucky are getting results back a lot quicker than they used to. Obviously, there is rapid testing that is not as accurate, but because it can occur so quickly, it can be of great benefit. The PCR testing, which is the most accurate, again, we need to get those results back faster. It comes back a lot faster than when we look back months ago, much, much faster. And that is helping us to fight the virus. What is my response to Bill Request 931, which is an act relating to, and this is what the sponsor called it, fairness for licensees and businesses during the coronavirus response and declaring an emergency. What this would do is prevent us from revoking food permits if a business chooses not to comply with executive orders. Well, if that's the case, then we can't stop another wave. We have done the same things recommended by the coronavirus task force headed by Vice President Mike Pence in each of our 3 waves, and each time it's worked. But if we have an inability to do what's necessary, then we can't stop the next wave, and we look like South Dakota. So obviously that would not be a good idea in the midst of a pandemic that is killing more people in Kentucky than we lost in World War I. I'd like to think that we don't fight the war against COVID with one arm tied behind our back, pretending it doesn't exist. Stu Johnson from WEKU.
Good afternoon, Governor, and thank you. There's reports about the use of vitamins, particularly vitamin D and C to a lesser degree, and zinc in treatment of COVID patients. And this may be a question for Dr. Stack, but is this something that should be, I guess I'll say, stressed more heavily as a regimen in I guess, a preventive way?
We're going to let a doctor answer this question.
Well, thank you for that, Governor. I wish there was a straightforward answer for you, but there are discussions about whether some of these vitamins can be a benefit or not, but there are no proven or clearly proven preventive measures other than wearing your mask and social distancing that will reduce your risk. And so a lot of this is still to be determined. And I would encourage you to seek professional medical opinion if you and the public have these questions before experimenting on your own, because we do from time to time have examples of people using things in unsafe combinations and at doses that are not helpful to them and actually cause harm. So for right now, your best measures are still the public health measures and seeking professional medical advice if you need that.
All right, Ryan Van Velzer from WFPL.
Thank you, Governor. A quick question for Dr. Stack and a question for you. For Dr. Stack, I'm curious, being that we're in the eye of the storm, what guidance does he have for people who might travel over Christmas or New Year's and are coming back to Kentucky? Second question for you, what does the AT&T outage have to do with testing and reporting in Kentucky?
Well, I'll start with that. It means many people's internet was down, and therefore they could not connect to upload their results to the NEDs and other systems. That's how they input the data to where we get it and the federal government. So there may be a backlog of some entries that still have to be done because they couldn't be done over the weekend. Steve?
Yes, sir. So right on our website on kycovid19.ky.gov, there's a travel advisory. And if you look at that, we discourage any out-of-state travel at this time. And if you do decide to travel, despite that strong urging to not travel, when you come back, you're asked to voluntarily quarantine for 14 days. And that guidance is all right on the website. And there's even links to CDC information that explain why that's important. And then just to the governor's answer he gave, there were significant outages for data systems around the state. And that does impact the flow of information. And so I think that was unavoidable. And I want to thank the hospitals and the medical community who I know labored during that time to still provide the best care possible, while clearly being hampered by the data outages.
All right, Tom Latek from Kentucky Today.
Good afternoon, Governor. Today, we had 4 state officials get their vaccination, 2 Supreme Court justices and 2 constitutional officers. But several of the justices and several of the constitutional officers have declined to get vaccinated at this point, preferring to wait their turn. What will be done with the vaccines that you have on hand that you could have used for this?
So those vaccines will go back into our state distribution plan and be allocated in that way. What we're having to do right now is address what's called vaccine hesitancy, especially amongst certain groups in the Commonwealth. There is a distrust, a concern, or maybe just some misgivings that need to be addressed so that people will take the vaccine. If we want to get to immunity, if we want to totally destroy this virus, which I do. They're now saying we need 75% plus Americans, but also Kentuckians to take the vaccine. And so that means that we need validators, people who are trusted by certain groups that are willing to step up and take that vaccine. And while hesitancy exists on some groups that can be demographic, there's also hesitancy that's seen in the numbers, even that breaks out in political parties. And so having 2 Republican office holders and our Secretary of State and our auditor are 2 leaders. Their positions are enshrined in the Constitution that validate to folks that we need to see that the vaccine is safe, that it's safe. Listen, I'm the governor for all of Kentucky. I want everybody to be safe. And if we recognize that there's more vaccine hesitancy among members of one political party than the other, I got to do what it takes and ask for help, which is what I did with those officials to make sure we address that hesitancy so that everybody can be getting this vaccine at the same time. We appreciate those that are willing to do it, understand those that aren't right now, but every single one of those officials said they will take it, that it's safe, and that's important for people to hear. Al Cross from Kentucky Health News.
Thank you, Governor. I apologize for the road noise. I'm in a vehicle. When will phase 1B begin? Or if you don't have a date for that, when will you be able to say when phase 1B will begin?
We believe that phase 1B, where we will be providing vaccines to those over 70, first responders and educators, will begin, February 1st, plus or minus a week. We hope that we're having enough vaccine out and distributed where we might be able to get it started that last week of January. And we anticipate that it will take us through most of February to get through group 1B. Now, all of that is really dependent, as I know Al knows, on the distribution schedule. I'd say the production schedule, but really it's what's allocated by the federal government to us. So we'll get the next allocation of Pfizer, just the numbers, tomorrow. I'll have to check about Moderna. That comes in at different times, but it is our hope that as early as the last week of January, but right now, target date February 1st. I want to thank everybody for giving us a little bit of time today. A lot of information that's out there, and there's a lot of information that's going to be happening from now until when we can get everybody vaccinated. Again, the virtue that I've got to ask everybody to show is patience, and it's going to be harder and harder and harder, especially as the virus is spreading so significantly across the country, to wait for this miracle that's out there. That we want to make sure that everybody gets to take. But just like in the beginning of this, when we had to ask everybody to wait on getting tested, we really need your help. And whether that's being a healthcare provider and you're in 1A, right? But still knowing that it's going to take some time to get through all that, or whether it's people who aren't even in 1B. Think about folks that are 60 to 70. That group is also hit hard by COVID. Just please have patience and know we're doing the best that we can. And I want to get this vaccine to you as fast as we can. So we will have another update tomorrow at 4. That'll be our last one for the week. And remember, as we end today, about the healthcare providers like Dr. Miller that are on the front lines, some of which have even sacrificed their lives for others. We have seen so many heroes during this pandemic. We can't thank them enough, but the way they want us to thank them, to show our gratitude, is to wear a mask, is to social distance, to follow the rules, and then we'll all make it through this together. Thank you all very much.